don't have time to do it. All right, so here we go. We have one of our good-looking patients here is doing one of the treatments we do very frequently for male facial sculpting, where we put in PDO threads, and this is a really unique type, you guys. This is a thicker, more robust thread. You guys could see the cannula here. If you can't see the barbs, there's not really a barb, it's more of a butterfly shape, but you can't see those barbs on the thread yet. I'm gonna show you in a second, but they are there, and what we're gonna do is we're gonna go really high on the jaw. See, the goal is that this little bit comes in like that over the next few months. So you can see we did a little bit of filler here right on the, basically the angle of the mandible, and we got a really nice contour. So, look how fast it heals. No, we're good. Just can't believe how fast that closes. Yeah, we made that again. I got it. All right, so we're gonna go right along the jaw, super, super high. Remember I showed you. We're gonna be right on the skin, right along the jaw. You might feel a little pinch, that's it. And then we just see where the placement is. We place, and then the key is to tighten. So we are going to, you might feel a little tug. There we go. We want to do that tug, it's really important. Grab me one without. Grab me one without. And now I'll show you guys another where we're gonna place and go a little bit lower. Perfect. Here. Again. And it always looks a little strange at first because it's gonna be a little swollen. But our goal is to really get this area along the edge of his jaw super tight. And how do we do that? Contour this, perfect. I'm gonna remove the threads, and you guys see, I'm gonna show you here the barbs. See if you take a little.
I'll show the camera, once you cut it, we'll show the camera up close.
You guys see here, right there, and then we'll cut them. You shouldn't have really any pain. We'll grab that, you guys can
You
show.
can probably see it a lot easier on this.
You're gonna feel me massage. So now what we
Put
do
on
is
some
we
gauze, you guys
massage
can
these
see
in
the barbs
place.
right here. That actually shows really well on live.
Perfect. Yep, so you guys
They
can
can
see,
see it.
you guys see how it's in multiple directions and it's super thick, which is really, really good. The other thing you can see here is, look, it's pulling up at the edge. So in about a week or two, and all this swelling kind of goes down and this tightens up, he's gonna really see a crisp edge on his jaw. Hold here really quick. I'm gonna grab
Someone wants to
there.
know, for
Perfect.
somebody
Go
in
to the other
their,
side.
for someone in their 20s, would you recommend threads or filler?
Both.
Well, that's the thing. Typically you do both, because remember, threads is for tightening and the fillers for defining. So I'd have to see their face, because sometimes,
It may depend, did they lose a lot of weight?
right, did they
Did
lose
you
weight
lose
and a lot of
weight?
laxity?
Do you need a neck lift? It really depends.
All right, so
They're
now
good
same
for the general
thing.
person. It's a good anti-aging to prolong the need of something bigger later on.
And here's what I tell people about threads. You don't see this initially, even though I'm showing you guys a little more dramatized, because I'm pulling it really tight. It's gonna relax in a day or two and be a little less noticeable. But then over the next, people always say to me about 6 to 8 weeks later, everyone says to them how good their neck looks or how tight they are. Look up straight for me a second. There we go. So you guys can see how much we were able to get that to lift. Look. And there's other ways, there's other things you could do, like you could do an early Renuvion or platismoplasty. There's other surgical things, but this is a very quick way to get a lot of collagen production and us to create more of this structure. So you see, like what we did right now is we're able to create more of this jawline structure that in the next few weeks, he's gonna see. So hold this straight, lift up a little bit higher, and like, look now. So you guys can see right here. So it's swollen, but look how much tighter it is there. Hold on a second, let me see this side. Same thing, swollen, but look at what it did. It pulled in so much and it lifted this up too. So it just enhanced what we now just did with the filler. So I'll lift him up just a little bit. Just stay how you are. Don't bend your neck yet. You just stay a little bit, looking up a little bit. Now look. So you see how this is all pulled in, and it's gonna look a lot tighter through here as this lifts this whole area up. Now there are something called reverse threads where we could come from this side and actually bring it here and pull it up even more. But I always tell people to wait a little bit because in 6 weeks, this is gonna tighten up. It's gonna look great. So that's male facial sculpting. Do a little pan because it's not only the facial sculpting, it's sculpting and defining with doing neck tightening. It's gonna be great. Amazing. It'll look great. So let me